Welcome to HEYS Reviews. So I've got a little preamble ramble for you tonight, so let's get into it. The part of the book we are at, we just finished the letter G and we're heading into the letter H, and that includes quite a large section on health services. Now, many of you who are familiar with Vernon Coleman and his work probably know that he is a GP, or he was a GP until he handed back his medical license. He's also a whistleblower. He is somebody who's been calling out the prevailing medical orthodoxy and trying to alert people to the failings in that particular industry. Now, the medical industry, it's kind of shady because it is very closely partnered with huge corporations that produce pharmaceuticals and medications and therapeutics, and that's a huge industry. There's a lot of money there. And so when it comes to selling health, there's so much money involved. People will always pay to be healthy. That's one of the three eternal markets, is health, wealth, and relationships. People will pretty much always be happy to part with their hard-earned cash if they believe that it's going to improve their health or make them more money or improve their relationships. So this has been well known, and of course we're all aware of snake oil salesmen and fads and marketing gimmicks and things that have been rolled out that turned out to be extremely detrimental to our health. Classic example might be thalidomide and all the birth defects that the use of that caused, and it was touted as safe for pregnant women. And of course, during the Big C event, we witnessed the unprecedented rollout of a completely novel technology, mRNA injections, technology that had never been approved for market consumption before, that had never been trialed successfully in humans or in animals before, just rolled out en masse to most of the world's population. I heard David Hughes say that only 23% of adults in the UK refused that particular offer from the pharmaceutical corporations in cahoots with the NHS and the governments. So that's the topic of today's video. We're going to be reading about Vernon Coleman's thoughts and experiences on the health services. So I thought for our preamble ramble, we would take a little look at the NHS and some associated articles and resources, because there are big changes afoot in the NHS, and these changes were actually announced in 2019, and I think you'll be very interested to see how much foresight this particular 2019 announcement had. But we'll start, as ever, in good old reliable Wikipedia, which never lies and is the fountain of all knowledge and truth and honesty and decency to be found on the internet. So this is the National Health Service, which is the term for the publicly funded healthcare systems of the United Kingdom, established in 1948. So there's a long history to this. The NHS was established as part of major social reforms following the Second World War. The founding principles were that services should be comprehensive, universal, and free at the point of delivery. Free at the point of delivery is very different to free full stop, and we'll see a little more about that a bit later. Wikipedia says that each service provides a comprehensive range of health services provided without charge for residents of the United Kingdom, excluding dental treatment and optical care. So this says it's only for residents, but we're going to see later in this article that that's not true. You can just rock up here and start getting treated by the NHS. You do not have to be a resident. And there's posters up in hospitals that tell you as much. So you don't need to have a passport or permanent residency or proof of address or proof of immigration status. You can just rock up to the NHS, get registered, and start receiving treatment. You can't get your dental treatment done or your eyes taken care of, though, unfortunately. Or maybe fortunately, I don't know. But taken together, the four services, so when it says the four services, it's just talking about England, Ireland, Scotland, and Wales. These four services employ around 1.6 million people, and that was 10 years ago. And it had a combined budget of £136.7 billion. So that's a huge number of people who are employed in the NHS. And the more I think about it, the more I wonder if the true purpose of the NHS is really just to keep a bunch of people employed so that it makes the employment figures look good, as well as other functions like data collection and eugenics as well, I think, or dysgenics, I think, is another key aspect of the NHS, because as we'll see on the history section, it was instigated, founded, cooked up and created by people who were massively into eugenics and its flip side, dysgenics. But in 2024, the total health sector workforce across the UK was 1.4 million, which made it the 7th largest employer and the 2nd largest non-military public organization in the world. So the 7th largest employer in the world is the NHS. It says when purchasing consumables such as medications, so the NHS has to buy medications, and this is where the NHS is in cahoots with private corporations and pharmaceutical companies. The four healthcare services have significant market power that influences the global price, typically keeping prices lower. So one of the questions you got to ask is, do you trust pharmaceutical companies? Are pharmaceutical companies delivering more health and wellness and well-being and good outcomes to the world's people, or not? Are pharmaceuticals risky? Are they dangerous? Are there negative side effects? Are there long-term ramifications for doling out these medications? Can they be found in places where they're not supposed to be found? There's all sorts of shady dealings and historical precedent for distrust of pharmaceutical companies, and yet the NHS is really in bed with them because they have to buy their medications from somewhere, right? The NHS doesn't produce its own medications. It doesn't have its own capacity for testing and developing and creating its own products, right? It has to buy them from private outfits, and then the NHS's interaction with these pharmaceutical companies then influences the global price. But don't worry, everybody, as Adam just spotted and mentioned in the YouTube chat, this means that the prices are typically kept lower, so it's a good thing. So all you non-UK citizens, you've got the NHS to thank for your cheap medication that you have access to, because we're buying it. As I said, we're buying it. It's not me doing it, but the NHS is buying it, and that's impacting the global price, keeping it lower. But what of the history of the NHS? Well, calls for a unified medical service, in inverted commas, can be dated back to the Minority Report of the Royal Commission on the Poor Law in 1909. Minority Report, we've talked about that on this channel before because that was authored by Fabian Socialist Beatrice Webb. It called for a system which was different from the existing poor law at that time. Now, of course, Beatrice Webb and her husband Sidney Webb, along with the likes of George Bernard Shaw and H.G. Wells, they founded the Fabian Society, and we read through the book Fabian Freeway in its entirety on the channel. You can check the playlists tab if that's something you're interested in catching up on, but it's very important history. And these people were not good people, even though they cloaked themselves in this disguise of wanting to do good for those who were poor and less fortunate than themselves. They also literally adopted the symbol of the wolf in sheep's clothing to be their main coat of arms. Right. So this is all about eugenics and dysgenics. This is all about making sure that the lower stock, the lesser stock, those that didn't have the important blood running through their veins, remained in their place, were kept ignorant and dumb and addicted and powerless and short-sighted and dependent upon the systems that would be run and administered by this bureaucratic class of self-proclaimed scientific elite and experts. Okay, so bear that in mind, because that is the context, the bigger, longer 100-year picture and context of what the NHS was born, where it was born from, and it helps us understand why it is where it is today. So that's the Minority Report. I think that was authored. Yeah, that was authored by Beatrice Webb. So following the 1942 Beveridge Report's recommendation to create, quote, comprehensive health and rehabilitation services for prevention and cure of disease, cross-party consensus emerged on introducing a national health service of some description. So cross-party consensus, that's an interesting term. It belies the lie of political parties actually being against each other. That's a pantomime. That's a Punch and Judy show, as Alan Watt would say. It is a red team versus blue team to keep people who are not that interested in digging deeper into the mechanisms of civilizational power over the ages. It is to keep them going, oh yeah, well, it's the blue team and the red team and they don't like each other and I choose one to vote for and that's me and my team and I identify with them and that's how it works. And we get to vote every so often and argue about who is the best team and who's a rubbish team. But actually there is a cross-party consensus. And this is what I'm trying to get at, and others whose work I support and encourage other people to look into, such as James Corbett, Last American Vagabond, Richard Grove, Whitney Webb, Vernon Coleman, Ian Davies, many others too, is there's actually a cross-party consensus. There is an agenda, there is a plan which both sides of the aisle agree upon and which is accelerated and progressed no matter who is voted in. So that cross-party consensus kind of hints and admits that a little bit. But one of the cross-party consensus items was some sort of health service of some description. It says a national health service of some description. So moving on, Clement Attlee's Labour Party won the 1945 election and he appointed Aneurin Bevan as health minister. And then the official historian of the NHS, the official historian. It's always good to compare the official history with the unofficial history where possible. But the official historian Charles Webster wrote in 2002 that the Luftwaffe achieved in months what had defeated politicians and planners for at least 2 decades. So you've actually got the Nazis to thank for your precious NHS. Lee Blunt, good evening. You're here on YouTube. Good to see you. Thanks for joining the live stream. So the NHS was born out of the ideal that healthcare should be available to all, regardless of wealth. Now, do you think that the healthcare you get on the NHS is the same as the healthcare that wealthy people get? Wealthy people who can pay for their healthcare. Do you think what you're getting for quote unquote free on the NHS is the same as what King formerly known as Prince Charles gets with his wealth? Or any billionaire you care to name, any CEO or high-flying exec, hedge fund manager, bankster. Do you think you're getting the same healthcare as what they're getting? That's the question I think is worth asking, right? But going back to the formation of the NHS, Conservative MPs were in favour of maintaining local administration of the NHS through existing arrangements with local authorities. So in other words, a kind of devolved model where you would be paying into the system near where you lived, and the local authority would administer it according to the needs of the people in that area. That's what the Conservatives wanted. The Labour came in and they said no to that, which is surprising, but that's what it tells us here. It says Conservative MPs voted in favour of their amendment to maintain local control and ownership of hospitals and against Bevan's plan for national ownership of all hospitals. And the Labour government defeated Conservative amendments and went ahead with the NHS as it remains today. A single, large national organisation which forced the transfer of ownership of hospitals from local authorities and charities to the new NHS. So this is centralisation of control. This is communism. This is socialism. This is technocracy. It's all the same thing, different words for the same thing. But the process is centralize control in as few hands as possible. Because if you had all these little hierarchies of control running their own health services in each constituents, then you could unpredictable things could happen because Each area is different. Decisions would be made differently in different areas, and it would be harder to maintain a top-down, this is the way it is type of narrative and control over things. But if you get it all under a single large national organization, then you force everybody sitting under that hierarchy to follow suit and to fall in line. So you enforce a consensus, in other words. So this is often why they want to centralize power in as fewer hands as possible, and they want to experiment on ways of doing that and achieving it and conning people into going along with it. So it's just interesting that the Fabian Socialists founded the Labour Party, and then it was the Labour government that insisted on making the NHS a single large national organization instead of this sort of devolved regional system, which the Conservative MPs of the time were in favour of. Bevan's principle of ownership with no private sector involvement has since been diluted. I like the language there. It's been sort of diluted. Well, it's been scrapped. It's been thrown out the window. It has been destroyed. It doesn't exist. It's dead, right? It's been diluted. Who by? The Labour governments have been diluting it. That's interesting, isn't it? Seen as the Labour governments are supposed to be the people who are very caring for those less fortunate and are very interested in stealing from the rich and giving to the poor and redistributing wealth and making sure that everybody has equal access to everything, particularly if you're non-native or from a minority or some sort of alphabet clownfish type person. It's interesting that the Labour government are the ones who diluted the principle of ownership with no private sector involvement, and they did this by implementing large-scale financing arrangements with private builders in private finance initiatives and joint ventures. So you got the Labour government to thank for that. It just shows you that this continuity, being aware of the Fabian Socialists, their creation of the Labour Party, and then the establishment of these public-private partnerships, there's that continuity there right through. It says, from its earliest days, the cultural history of the NHS has shown its place in British society reflected and debated in film, TV, cartoons, and literature. So, fiction, in other words. The NHS had a prominent slot during the 2012 London Summer Olympics opening ceremony, directed by Danny Boyle, being described as the institution which more than any other unites our nation. And if anybody is unfamiliar with the 2012 London Summer Olympics opening ceremony, you have to go and watch that. It is creepy. It is a huge sort of initiation, ritualistic, symbolic, black mass of some description. And there are many videos online of people breaking down the symbolism. For example, Russell Brand was there dressed as the child catcher from Chitty Chitty Bang Bang. And there was also this giant ball with spikes coming out of it that kind of looked like the CGI representations of a coronavirus molecule that we saw on our 6 o'clock news reports. There was even one of those, I think it was silver though, and it floated out. And there was lots of people, children in hospital beds. The whole thing was very occult, full of occult imagery, and there's a lot there to see. And yes, of course, Danny Boyle did direct it. And funny that he got a mention here. I'm sure probably just an accident, though. So there's a section here on eligibility for treatment. It says everyone living in the UK can use the NHS. So remember earlier up in this article where it said residents? Well, down here, yeah, actually, it's just everyone. Just everyone living in the UK. What do you mean by living in the UK? Well, you know, if you're alive and you're in the UK, then you're living in the UK and you can use the NHS. So no wonder people want to come here, right? It says patients who do not qualify for free treatment are asked to pay in advance or to sign a written promise to pay for treatment. I didn't know you could get away with that. Yeah, I'll write down. I'll write down on a piece of paper that I promise to pay you. Yeah, sure, I'll do that. And then in exchange, get healthcare. It's a pretty good deal, don't you think? Funding. The NHS is funded by general taxation and national insurance contributions, plus around 1% of funding from patient charges for some services. So remember above when I said free at the point of delivery, because it's not free if you're getting taxed. It's a bit of a double speak, double think type of a new speak, double think kind of example to say that it's free and yet it's funded by taxation. But what about the staffing? Well, it's the largest employer in Europe, with 1 in every 25 adults in England working for the NHS. That's an amazing statistic to me. That really blew my mind when I read that. It's quite incredible, that statistic. Nursing staff accounted for the largest cohort at more than 330,000 employees, 33, followed by clinical support staff at 290,000, scientific and technical staff at 163,000, and physicians at 133,000. That's a lot of people. That's a lot of people. And yeah, as Adam says, it's free, but you have to pay for it. Exactly. So, it's like, yeah, it's just, it's Orwellian, newspeak, doublethink, and you have to hold both concepts as true in your mind at the same time. This is a contradiction. There is no contradiction in nature, in reality, only in your mind. And holding contradictory facts as true in your mind leads to relativism, which then becomes moral relativism. What's good for me is bad for you. What's bad for me is good for you. And that leads to the whole mess of a shit show that we're living through, right? If you want to go back to the mind and how the mind, what is believed, what we think, what we hold up here in our mind, what we investigate and know about reality leads to our behavior and our actions and our words and our emotions. There's a good case that it all starts with thought. And if you are holding contradictory pieces of information in your mind as true, then you're more likely to make mistakes and do things that are harmful and detrimental to your own well-being. I'm just gonna have a sip here. Just got to pour a bit of tea. Mouth's getting a bit dry. Lee Blunt says, I remember the demons running around the beds in the 2012 Olympics. Yeah, I was amazed on how little this ceremony was talked about or even watched. Very dark. Well, a good example is the Paris Olympic ceremony, the recent one. That was crazy. Had lots of really wild stuff in it as well. I'm sure they all do, but the 2012 one was quite amazing, and it's worth looking at and analyzing. And if you are unversed in symbolism, then you can watch videos of other people analyzing it, and it'll help you understand it. But it was quite shocking, especially with the hindsight of the Big C event. It's amazing what they programmed in there. But of course, the NHS is not perfect. It has issues. In July 2022, The Telegraph reported that think tank Civitas found that health spending was costing about £10,000 per household in the UK. They said that this was the third highest share of GDP of any nation in Europe, and claimed that the UK has one of the most costly health systems and some of the worst outcomes. So it's costing us loads of money. This free service is costing us loads of money, and it's not even delivering good results. The Labour government in 2024 stated that their policy was that the NHS is broken. Well, didn't you break it? Who's responsible? This is the same group of politicians and the same political party that insisted on centralizing this whole thing and privatizing it by the back door. And now it's coming out, this same political party is coming out saying, oh, it's broken. It's broken and we need more money to fix it. This is what they always come out and say after every election, isn't it? But the Labour government elected in 2024 announced an immediate stocktake of current pressures, which was to be followed by a new 10-year plan for the NHS to replace the NHS long-term plan published in 2019. So in 2019, they published a 10-year plan, and they got 5 years into it, and they were like, no, we need a new 10-year plan because the last 10-year plan was so good that we need to interrupt it halfway through and do another 10-year plan. And it's that classic thing of you can't fix a problem by the same level of consciousness that created the problem. So it's laughable, really. Professor Helen Stokes Lampard of the Royal College of GPs said, "It's a great testament to medical research and the NHS that we are living longer. But we need to ensure that our patients are living longer with a good quality of life." Yeah, I totally agree with that. "For this to happen, we need a properly funded, properly staffed health and social care sector with general practice, hospitals, and social care all working together." Do we, though? Because haven't we had that? Haven't we had that for nearly 100 years? And it's delivered the problems that we're seeing now, right? So I'm not sure that more of what we already have that is not working is really the solution to this problem. There's a section here on employment and waiting lists. On the 6th of June 2022, The Guardian said that a survey of more than 20,000 frontline staff by the nursing trade union and professional body, the Royal College of Nursing, found that only a quarter of shifts had the planned number of registered nurses on duty. So that's reassuring. And this is reported in The Guardian. The NHS will potentially have a shortage of general practitioners as well. And this is why we have to import lots of people from other places. Mental health. 1 in 4 patients throughout the UK wait over 3 months to see an NHS mental health professional. Over 3 months. The National Audit Office found mental health provisions for children and young people will not meet growing demand despite promises of increased funding. So even though you pour more money into it, it doesn't fix the problem, right? So people who tell you, we need to put more money into this thing to fix it, you got to be skeptical about that as a solution. You can't just throw money at things and expect it to change. The changes are deeper, more fundamental to our thinking, to our beliefs, to our behaviors. It really gets deep into human psychology and human psyche, down to the level of culture, down to the level of history and truth and morality. These are bigger, deeper questions, but they're never addressed. It's always the solutions are always surface level. They're always stick a Band-Aid on it, a plaster, wrap it around, put a bit of cream, a bit of Savlon on there, and then, you know, maybe run it under the cold tap. There's that classic bit in Shaun of the Dead where his stepdad gets bitten by a zombie and he's like, "I'll be okay. I'll run it under the cold tap." That's what it's like. We never get to the root cause of these problems. The politicians never do, I mean. And that's because their whole existence and livelihood and way of life depends on not fixing the problems. Because it's like anything. If you fix the problem, you make yourself redundant. And this is why so many business models are questionable. Because if you actually fix the problem you promise to fix for people, you might be putting yourself out of business. So you got to bear that in mind, right? When you buy a product or a service, are you actually going to get rid of your problem, or are you just signing up to some sort of treadmill, some hamster wheel of payments that's just going to go on and on and on and on? Because some business models are predicated on not fixing the problem, because a patient cured is a customer lost, right? A patient cured by the NHS is a customer lost to the pharmaceutical companies that the NHS buys all its products from, right? So, rant over. Apparently, 1/4 of young people who need mental health services can get it. Only 1/4. So that's how well this socialized health care services is doing for our young people. But don't worry, because they're being inclusive and they are requiring that radiographers ask all male patients if they're pregnant. And there's actually 4 references to back that up. Evening Standard, Telegraph, Sunday Times, and The Independent. So, it's going well in the NHS. This section is about performance. A 2018 study by the King's Fund, Health Foundation, Nuffield Trust, and the Institute for Fiscal Studies to mark the NHS 70th anniversary concluded that the main weakness of the NHS was healthcare outcomes. The only thing it's supposed to do is deliver healthcare outcomes. So how can the main weakness be healthcare outcomes? That's like going to a restaurant and being like, the main weakness of this restaurant is they can't cook food. That's just bizarre. Okay, 2018 study, so not that long ago. In 2019, The Times commented on a study in the British Medical Journal which reported that Britain spent the least on health, which is £3,000 per person, compared with an average of 4,400, and had the highest number of deaths that might have been prevented with prompt treatment. So all the money that is being taken from people and poured into the system doesn't seem to be making us healthier. And of course, happiness is predicated on health. It's very difficult to be happy if you don't have health. Health comes first. Health comes first if you want to be productive, if you want to be successful, if you want to get anything done, really, you have to be healthy. People are not getting healthier. Yet we still pay all this money into the system which employs nearly 1.5 million people. And the main weakness of the NHS was healthcare outcomes. That's just shocking, really. Over 130,000 deaths since 2012 in the UK could have been prevented if progress in public health policy had not stopped due to austerity. So remember, I'm always talking about, in this book in particular, is talking about sustainable development, and I'm always saying it's sustainable austerity. Well, this is what happens with austerity. It causes people to die and suffer and be in pain and have a really shit time of it. Good evening, Plutonian Productions and Plane Drifter. Good to see you. ESP as well over on Odyssey. Hope you're doing okay. Saying, I forgot to mention, I've been in hospital. Sorry to hear that, ESP. I hope you're doing better now. And I'm glad you survived your encounter with the NHS, because a lot of people don't. So what about the public? What's the public perception of the NHS? Well, this bit gave me a chuckle indeed. Support for higher taxation to pay for extra spending on the NHS. So the public perception is we need to give the NHS more money. 70% of people were willing to pay an extra penny in the pound in income tax. 2/3 favoured increased taxation to help finance the NHS. 74% of the UK believed there were too few nurses. A 2018 public survey reported that public satisfaction with the NHS had fallen from 70% to 53%. So I don't know if you can trust polls. I think you can't. I think most of the time these polls are rigged in such a way as to spread the idea that there is a consensus out there, and if you don't agree with it, then you're the odd one out, and you're lonely, and you are weird and an oddball, and that maybe that you need to be investigated by the police for your opinions. But who knows, right? You'd be better off doing your own poll. You know, walk up and down the street with a clipboard, say, hello, my name's Nick, and I live in that house over there, and I know we never met, but I'm trying to get to know my neighbors, and I'd like to know your opinion on the NHS. Do you use it? Do you think it needs more money? Are you satisfied with how it's going? I bet it would be amazing to hear on-the-ground reports of that kind. And of course, some people will have great things to say about it, because there are some, because it's full. There's over 1 million people working in the NHS. Plenty of those people are going to be good, well-meaning, well-intentioned people, right? But plenty of those are going to be psychopathic nutcases who don't know what the hell they're doing and just just do what they're told without any shred of critical thinking. Because that's what happens when you have this like centralized top-down thing. You don't teach people to be nuanced, to take into account individual circumstances and situations that are relevant to the place where they're working and operating. You just have this cookie-cutter approach. Here's a policy. This is what you do. Check that box. Ask this question. Move on to the next person. And that is what it feels like in some hospital situations and in some encounters with this system. You do feel like you're on a conveyor belt and they're just processing you to get to the next one so that they can, because that's their job, right? And you get bounced around from pillar to post. You might see 5-6 different people for in a given appointment, and then you go back for your next one. It's a totally different group of people. Nobody knows who you are, and you are relying upon their information capture system to have all the relevant information. And nobody really gets to know you, your background, your history. You don't have that personal connection with a doctor who knows you for your entire life or a good portion of it. You just get bounced around to strangers, and there's this fallacy sort of built into the way it works. That is, everything written down on the computer database is accurate and is all that a person needs to know before they treat you or give you some help or whatever it is that you're there for. So, yeah, get out, talk to people in the real world about their opinions. Don't believe polls. That's what I'm trying to get at here. In November 2022, a survey by Ipsos and the Health Foundation found that 82% think the NHS needs more funding. And then here we are, just the cherry on the cake of the Orwellian doublethink. 90% of respondents believe the NHS should be free. 84% of believe the NHS should be funded through taxation. So it's free, but you pay for it. You got that? It's free, but you pay for it. We'll pay for it, but we'll keep it free. We need to pay. We need to spend more money on it so that it can continue to be free. It just doesn't make sense. And you're not allowed to opt out of it. You're not allowed to say, I'm good. I don't want to use that system. Thanks. I'll take care of myself. I'll grow some herbs and I'll do some exercise and get some sunlight and eat proper food and read some books about nutrition and physiology and take care of my mental well-being. And I'm not going to use your system. Therefore, can I keep my money and not pay into it? Nope. That's not an option. But it's free. What was the role of the NHS in combating the coronavirus pandemic? Well, in 2020, the NHS issued medical advice and partnered with tech companies to create computer dashboards to help combat the pandemic. Brilliant, because that's exactly what we needed. Computer dashboards can solve everything, can solve all the problems, right? People are getting sick and getting ill and scared and worried and staying indoors and being traumatized by their governments. And do you know what we need to do? Computer dashboard. That's going to help the situation, isn't it? Nice one, NHS. I'm sure throughout all the previous pandemics that happened throughout history, people were sitting around going, do you know what we need? It would be really great if we had a computer dashboard to help us deal with this. Following the discharge from St. Thomas Hospital in London on the 13th of April 2020, after being diagnosed with C19, British PM Boris Johnson described NHS medical care as astonishing and said that the NHS saved my life, no question. I don't believe for 1 second that story is true or that he gets the treatment that people who use the NHS get. No way. Not given his background and his wealth and his upbringing and his influence and his power and his prestige and all that stuff. He's from the other class of people who get the higher level of bonuses and benefits because they roll out the policy. And his role in particular is very important because he stands there annoying people and receives all the anger and the vitriol. And he basically, as Alan Watt would say, gets tomatoes thrown at him. That's his role. He's a clown. He's a clownish, buffoonish type of silly haired man. And we're supposed to think he's in charge of running the show, or was in charge of running the show. Don't forget, his dad also wrote the book Life Without Birth, and his dad also wrote the book The Virus, which was a novel about a virus. A novel virus, in fact. A novel about a novel virus. On the 5th of July 2021, Queen Elizabeth awarded the NHS the George Cross. So for bravery and valor. And it applied to past and present NHS staff. So out into the future, all the people who go, if you go and work for the NHS, then you can say you received the George Cross, even though you weren't there during any of these events. And like the moment you start working for the NHS, you can claim, you put it on your CV, received the George Cross for heroism and conspicuous courage. You can, if you work for the NHS, you can put that on your CV. In October 2022, as part of their efforts to tackle mental health challenges made worse by the pandemic. No, they weren't made worse by the pandemic. They were made worse by the governments and the media companies and the ridiculous rules and the censorship and the social media platforms and the tech companies and the pharmaceutical companies and all the people who were complicit and went along and didn't speak out and didn't ask questions and didn't encourage critical thinking, it wasn't the pandemic. It was, as Ian Davies would say, it was a pseudo pandemic. And it was not the pandemic that made mental health challenges worse, right? It was governments, it was people, it was organizations, it was think tanks, it was Neil Ferguson and his shitty computer models at Imperial College, right? But NHS, in true technocratic fashion, tried to tackle these worsening mental health challenges by partnering with an Israeli tech company and stating that their AI-powered software translates complex genetic, demographic, and clinical patient data into time-saving and cost-saving assessment, management, and prescribing support tools for healthcare providers. Right. Okay. Yes. More computer dashboards, please. More money to Israeli tech companies, please. That will solve all our problems, don't you know? Care mistakes. A 2024 report by the Public Research University, Imperial College London. They did the dodgy models, didn't they? For which prompted the lockdowns. Anyway, those guys said that the NHS spends 14.7 billion a year treating patients in England hurt by care mistakes. Hurt by care mistakes. Oh, I'm sorry that the treatment we gave you has made you into now like you're addicted to painkillers, or sorry that the doctor made the wrong call and he chopped out the wrong part of you and now you're crippled for life. Oh, it was a care mistake. If that's not Orwellian language, I don't know what is. But yeah, people hurt by it was a mistake, but it came from a caring place. It was a care mistake. It wasn't a incompetence mistake. It wasn't a gross negligence mistake. It wasn't a mistake due to something much worse, psychopathy or sadism. It was a care mistake, and that's costing the NHS £14.7 billion a year, apparently. So that's the Wikipedia page on the NHS, and it's not a bad introduction. It's fairly even-handed, gives you a little history and gives you some of the criticisms and the problems. It's not the most glowing recommendation of the NHS that I've ever seen, to be honest. But did you know that the NHS have been releasing a number of charity singles since 2015? Yes, they have. I'm not going to torture you with sharing them on tonight's stream, however.